You are actually my senator, so I'm really excited to be speaking with you right now. So you are doing Votorama today, which is absolutely pandemonium. And you spoke the other day about this reconciliation bill breaking some rules. Can you talk about that a little bit?
First of all, thanks for having me on. I'm excited as well, and to talk about what's happening in the Senate. So, you use the word votorama, which sounds a lot more fun than it actually is. It's not very often, but every once in a while, there's a single political party that controls all, both houses of Congress and the White House. And so when that happens, it was Democrats just a few years ago. Now it's Republicans. There's a unique opportunity to move forward a budget bill. That's what we refer to as reconciliation. But it has some restraints to it, right? You can't just throw all the rules of Congress out and do whatever you want. And so that's why we have a parliamentarian, sort of an umpire, a referee of the Senate to say, no, this is eligible for reconciliation, this is not. All that being said, bottom line before us is a big, ugly bill that encapsulates most of what Trump wants to achieve in his second term. You know, cuts to so many important programs that so many families rely on, access to health care, nutrition assistance programs, on and on and on, while at the same time underwriting tax breaks for billionaires of all people, the most wealthy in America. But that's the Trump agenda, and Republicans in Congress seem hell bent on going along. And so that's what we're taking up right now with efforts on both sides of the aisle to amend this bill. Democrats trying to make it better, Republicans trying to make it worse.
And a lot of these Medicaid cuts are going to affect rural Californians. What is at stake right now for things like our hospitals here?
So I think of the big ticket items to cut, Medicaid, which in California is really Medi-Cal, for people who rely on it. Millions of Californians rely on it across the country. You know, the original draft of the bill would have cut off 16 million people from access to their health care. The changes that Republicans are now proposing means maybe closer to 20 million people will lose their health care. And so that's real. Number one, for an individual and family, because health care is expensive if you have no type of coverage or insurance. Number two, with that loss of funding, you have a lot of hospitals, both public and private sector hospitals, that are going to see their revenues significantly drop. And one of the concerns I've heard from constituents in different parts of the state that I've shared with my colleagues, because there are people out there who say, well, I don't have Medi-Cal, so it won't affect me. You're wrong. If you go to a hospital or a clinic that treats people that have Medi-Cal as part of their coverage, all of a sudden their revenues are going to shrink. And that's going to mean either a loss in services they can provide, a loss in staffing, or outright closure. We have a number of hospitals in rural areas of California that are on the brink of closing if they don't get relief. So we're fighting for more funding for them, not less. But again, that's one of the consequences of this big budget reconciliation bill that Republicans are putting forward.
Do you think that Republicans are being honest with their constituents about what's on the line right now?
No, I don't. Absolutely not. When they say, and Trump has at times said he doesn't want to take anybody's health care or medical, but that's exactly what they're proposing if you look at the bill. Another big lie, ways in which Republicans are misleading here is when we ask them, so why is it that you want to cut health care? Why is it that you want to cut nutrition assistance programs? Why is it that you're proposing all these cuts in the federal budget? Part of their answer is really, well, our nation's debt is out of control. We have to reduce the debt. But the independent analysts say that this bill actually increases our nation's debt. So how is that possible? If you're cutting the budget, how do you increase the debt? Because again, it's all with the purpose of underwriting further tax breaks for billionaires and large corporations. So that's yet another way in which they're lying to the American people. And look, if as you're hearing this, you sound upset and offended like I am, think back to 2017 during the first Trump term, when they argued, for the Trump tax cuts at that time benefiting the wealthy and large corporations that, we could afford this. and this is going to grow the economy and it's going to address the nation's deficit. Of course, that wasn't true then. And it's not true now. But now, instead of running back in some of those tax breaks, they're saying let's pay for them by cuts to healthcare, cuts to nutrition assistance programs, cuts to a lot of the projects and programs that we authorized in the Biden administration that helps our economy shift from a fossil fuel economy to a clean energy economy. That's another item that's on the chopping block.
Yes, in your speech the other day, you were saying, I guess we came to Congress for different reasons. And I wanted to ask, what's your reason? What keeps you in this fight? Because I know a lot of us are very overwhelmed. The stakes are so high and so personal. So what keeps you going?
Yeah, no, it can be overwhelming because the amount and the extent of the announcements and proposals and executive orders and things coming out of the White House, especially. So what keeps me going? The very reason I got into public service is because I believe government can do good and is there to help people, especially the most vulnerable in our society. I mean, I haven't heard over the years of any candidate for office, a Democrat or Republican, saying, vote for me because I want to eliminate your health care, or vote for me because I'm going to decimate education, or vote for me because, they want to make matters worse. But that's exactly what they're doing with this. Any Republican who votes for this bill is voting to take away health care from people who need it, is voting to eliminate the nutrition programs. I mean, think about the seniors who rely on nutrition assistance programs. Think of so many kids in our schools who rely on nutrition assistance programs. That's the level of cruelty that we're seeing with this bill. So I wanted to make it clear in my speech that you're referencing that this really is also a value statement. It's not just about how do we balance a budget, but it's a statement of our values. And I know what I'm here to do. I'm here to have government help people. Republicans, what are you here for? Who are you fighting for? Who are you seeking to represent?
Yes. Oh my gosh. Thank you so much, Senator Padilla. I am so glad that you represent me, and thank you for the work that you're doing in Congress right now.
No, absolutely. So much more to do to keep the American dream alive. And look, we're blessed being from California, right? We're not just the most populous state in the nation, we're the most diverse state in the nation. We have the fourth largest economy in the world. The rest of the country should be trying to learn from us and replicate our successes, not attack us for a different political philosophy.